Hi, everyone. Welcome to this week's Stanford Live. I'm super excited today. We have Mary Beth Cambridge, who is our patient care manager on each one, which is ENT, plastics, and pain. She was one of the first managers I connected with when I started here at Stanford, and I've had the pleasure of working with her in so many different avenues over the last couple of years that I was so excited to see this email come across my desk that she wanted to do one of these events. So without further ado, I guess I will pass it over to have Mary Beth introduce herself and her team. We are joined today by her assistant patient care manager, Teresa Weiss-Carver.
Hi, good morning, everybody. My name is Mary Beth Cambridge, and as Carly said, I'm the patient care manager on H1. We serve the ENT, plastic surgery, and chronic pain population, which I'll tell you more about our unit in just a minute. Just wanted to tell you a little bit about myself. I've been at Stanford for about 6 years now. I came from another organization previously where I worked for 12 years. I've been a nurse for 18 years. I spent about 15 years at the bedside, and I've been in management, managing this unit for 3 years now. So it's been a great experience. I love being a patient care manager. I love welcoming new people to our team and seeing them thrive. And then I'll let Teresa introduce herself.
Good morning, everyone. My name is Teresa Weiss-Carver. I'm the assistant patient care manager here on H1. I've been a nurse for about 11 years now. I started my career on the East Coast, but the Bay Area is home, and I came out back to Stanford about 7 years ago now. And I actually started on the ENT and plastic surgery unit, worked up to a charge nurse, and then into my current role as the assistant patient care manager about 3 years ago. So you can say I really love this unit. I really love this patient population, and I think that's shown by how long I've stayed and my commitment to this unit. So welcome, everyone.
Great. And as you've heard, Teresa is very dedicated to our patient population. Our ENT patients, ear, nose, and throat, are primarily those who are recovering from head and neck cancer and are coming in for extensive reconstructive surgery and tumor debulking. So our patients require fresh trachs. They require reconstructed of the oral cavity and jaw, where the surgeon will take tissue from the lower extremity or the forearm and use it to reconstruct the oral cavity. Our nurses are they get great education on trach management and troubleshooting. So we don't rely on RT because we are actually so knowledgeable about trach and trach care. We really pride ourselves at giving great patient education and setting the patients up for success going home, either with a trach or we can decannulate them before going home. We are proud to say that our ENT service was just recently ranked #1 in U.S. News World and Report, which also really reflects on the great nursing care we give. Our length of stay is low. We have very little complications here, which really speaks to the great nursing care that we give. And then our plastic surgery population is probably like one of my favorite because we do so many cool things with our plastics patients. Our plastics patients are primarily those that have had breast cancer and now are coming in for breast reconstructive surgery. So that's where the surgeon will take muscle and tissue from the abdomen and use it to reconstruct the breast. The nursing care is imperative. It's where you have to check that flap site every hour and ensure there's no compromise to perfusion. And our nurses are key to making sure that those flaps are successful and notifying the surgeons right away if there's any concern. So we're very proud that we can, our care makes these surgeries successful. We also see traumatic accidents from our plastic surgery population, those with woodworking accidents where digits have to be reimplanted. We also we've done stuff where we grow tissue on forearms to reconstruct ears. We do leech therapy. So it's a really it's a really interesting population because there's just things that you see that you just never have ever seen. Like we see new stuff all the time with that service. So it's a great environment to learn in. Even if you've been a nurse for a while, this is the unit you want to come to if you want to learn more and really see some exciting stuff. And we do serve another population, our chronic pain population. Those patients come in for ketamine and lidocaine infusions. And basically the thought is those medications help reset the nervous system so the patients actually require less opiates. And we get to know those patients really well because they do come back every few months. So that's very rewarding. Carly?
Thanks, Mary Beth. I'm learning so much myself. I feel like I thought I knew your unit, but I'm learning more now during this call. I love just the broad overview you just gave of your department and just kind of, the different kinds of patient opportunities that you see. So kind of delving into your unit, and Teresa, feel free to jump in, whoever might know more here. When you look at your team, where do a lot of your nurses start off, in similar units and come over? Do you find nurses coming from, cross-training programs? What ideally is your team made up of in terms of experience and how they wind up on your unit?
Teresa, do you want to take that one?
Sure. Yeah. So generally, we're looking for nurses with a great, interest in nursing and who are willing to learn and expand their knowledge. We don't expect people to know our patient population because it is so unique, and a lot of people do not have our experience. So, someone with surgical experience is great. Who has worked with a lot of surgical drains, general surgery, a lot of feeding tube. If you have trach experience, that's a bonus. But our nurses really love to teach new people to our team. They're really proud of their service and their specialty. So they really enjoy getting to teach that to others, as well as our APPs and our residents really enjoy teaching our nurses about all these specialties. Our unit educator does provide specialized classes to teach these throughout orientation. So there are 2 4-hour block sessions that she does individually with people on orientation just to delve into these specialties even deeper. So really someone who just finds what we're doing interesting, is wanting to learn and curious and better themselves. Those are the kind of candidates that we're looking for our unit.
I love that. And, once someone comes on to your unit, and they grow within their position, Teresa, I'm going to kind of put you on the spot because you've said you've grown here. So what are the different growth opportunities that someone can expect when joining the unit?
Yeah, so I think we're very proud to say we have a lot of nurses that have stayed on our unit for a long time, from new grads who are now charge nurses in different roles. So I think, kind of the path of growth is generally, really learning that specialty, becoming an expert in it, then becoming a float nurse or a break nurse, some other places call it, then moving into that charge nurse role. And then there are opportunities within the unit and the hospital to be involved in shared leadership council, to work on improvement projects on the unit and within the hospital. Our unit educator started on our unit and now works in that role as well. And there are tons of opportunities within the hospital for growth and involvement and learning. And I think that's one of the great things about our unit and Stanford as a whole, is that everyone really encourages people to continue learning and growing, and there's as much opportunity as you seek out. And I think I'm a testament to that myself, because I went through all those stages and now in my current position.
Oh, that's awesome. Thank you for that overview, Teresa. Another thing that we often hear about when people are asking about joining us and joining our team, Mary Beth is the leader of the unit, essentially. What do you do to help build such a cohesive team and kind of make it, your work family? Everyone always says, oh, they're part of my work family. But, as you and your assistant patient managers, how do you guys create that cohesive unit? Do you do different team building activities? Do you do different things there just in the day-to-day on the unit to make sure that everyone, feels like they're supported and that everyone around them has their back, they're being mentored to the best, so they can be their best nurse that they can be on the unit?
Yeah. I can definitely speak to that. We do have like retreats. We're actually planning one at the end of September where we'll be outside and just give that time for staff to connect. We invite guest speakers that kind of like help refresh and motivate folks. I would say for us, we are our own individual like management team. We do really pride ourselves on one-on-one connections with staff. I can say for me personally, we have a clinical ladder system here where, you start off normally as a clinical nurse 2. And there's a program here called Professional Nurse Development Program where you can achieve a clinical nurse 3 and a clinical nurse 4. So I actually really encourage people one-on-one and really mentor them through that process. So they can get recognized for the work that they're doing and get the extra compensation for it. Teresa and Elise, who's not here today, which is our evening assistant patient care manager, also really connect with people one-on-one for understanding like either their scheduling needs or if there's something going on at home. And I think with the support of the management team, understanding that life is just not here on the unit, it happens, outside, really makes them feel supported. And then it also really helps them feel connected with their colleagues as well. Teresa, anything else you want to add?
I would just say that definitely one of the biggest things that we pride ourselves on as a unit and our team would say is that teamwork and trusting each other is one of the biggest things. And so that's really what we're looking is to add to that culture where everyone knows they have each other's back. And I can truly say that all of our nurses and nursing assistants, they really enjoy working together. And they really have a really great trust for each other. And that's a really great environment to work in.
I love hearing that. Kind of staying on the same page of, promoting the unit. I work a lot with new grads. I help partner with our new grad program. And a lot of the times when we're going through the application process or the Q&As at the beginning, the new grads are asking, okay, well, there's these medicine units, there's these surgical units, there's so many here at Stanford, and they're called AAUs. What is that? For someone that, I guess AAUs in general, how is it best to explain it? And for new grads saying, why would you recommend I pick ENT plastics over maybe another one to be more interested in or learn more about? What do you feel makes your unit stand out, whether it's the culture, the patient population, the team itself? What are some different reasons where like you're really proud to be on that unit?
Yeah, I can take that. I would say that our unit really gives an opportunity for a lot of learning, a lot of things that you don't see anywhere else. You really get to have the opportunity to critically think because our patients are so specialized. Our patients have to come from all over the state and even the country for our services because other organizations just either don't have that expertise in taking care of some of these, cancers of the plastic surgery and ENT realm. Why would I say come here? I would say, first of all, it's the people. Like Teresa was saying, there is a lot of trust between the RNs, the NAs, the unit secretaries. I feel that the management team has a really strong connection with our staff. We care about them. We want them to grow. We want them to succeed. We want to understand what their career goals are. And we want to help them get to where they ultimately, want to be. And honestly, the physician partnership we have with our ENT and plastic surgeons, they like to teach. They are very protective of their patients because it's such a specialty. So they really also, again, going back to that word trust, they trust the staff here. They know that their patients will get the best care on this unit, which is something to be really proud of when surgeons, make sure that their patients come here because they know that this is where they'll get the best care. Teresa, do you want to add anything?
I would just say to kind of speak to Carly's point about just what an adaptable acuity unit is, or an AAU unit. So that sort of model is that we are able to flex between a med surg level of care and an IICU level of care, depending on the patient's acuity and their needs, their nursing intervention needs. And what that allows is that our patients come from the PACU, majority of them, and they're able to stay with us throughout the entirety of their hospitalization, which really helps that with that continuity of care and is a big satisfier for our patients. So based on their level of care, we do our nursing ratios and assignments. But once they are changed from an ICU to med-surg, they don't have to be changed to another unit. So that's a really great thing about the adaptable acuity units. And I think it's a satisfier for both our patients and our staff. And then, yeah, I think I echo everything Mary Beth said about our unit and why us. And I always like to say that, you know, our specialty is so unique. Our nurses really hold that with the like pride and badge of honor. And I think it's a really great unit to learn on because trach care isn't something that you see everywhere. These surgeries aren't things that you see everywhere. So it's a really great foundation for you to learn a lot. I think we have a lot of pride that, you know, our patients really can't go anywhere else in the hospital. Like we really are the owner, we own that nursing practice. And that can be really cool to experience and something that I think makes a lot of our staff really proud that they have that knowledge.
Oh, thank you for explaining that, Teresa. I wanted to pivot for a minute. We have Jennifer Delgadillo, who is the talent acquisition specialist that oversees this particular unit. And I feel like she's gotten to kind of sit back in the background. But I wanted to kind of put you on the spot, Jen. So, you know, everyone's learning about Mary Beth's unit here, you know, the great opportunities that they have. If you can kind of walk everyone through what's the hiring process for these type of units. And, you know, if someone's looking at maybe someone else here in the Bay Area or even looking to relocate here from elsewhere, what makes this a great opportunity for them? And what are some of the perks that Stanford offers?
Hi, everyone. Yeah, thanks, Carly. So, hiring process, first thing I would say is to go to our website and apply directly. Now, you guys can always reach out to me directly and, you know, send me a resume, or you can connect with me on LinkedIn, and I'm happy to connect you with the hiring leaders. What the process would look like is I normally will review the resume, make sure that, you know, it is a good fit, and then we would normally send it to Teresa, Maribeth, and Elise to review the resume. And I will say proudly that H1 is one of the fastest units to reach back out and say, this is a great candidate, I'm going to give them a call. So definitely expect, once your resume gets forwarded to them, that they will be on top of it and will be reaching out to you guys. So definitely be prepared for that. And then they will go through the interview process, check references if it's a good fit. And usually we do have offers out within a week of you interviewing for the role. Obviously, that's kind of a case-by-case scenario, but we do try to move quickly. So as far as the interview process, that's how that goes. Some of the perks that we have, obviously Stanford is one of the top facilities in the country. So offering very high compensation. We do have really excellent benefits. In fact, we offer 3 different benefit medical plans that you guys can choose from. We have a 401k that we match anywhere from 5 to 8%. We have PTO, and our nurses actually start with 26 days of PTO and go up to 39 days once you are, you know, you've been with us for 10 years. We do offer our benefits that will kick in within 30 days of you starting with us. We also, for this particular unit, we do offer relocation on a case-by-case scenario. If you know, upon request and approval, of course. So definitely, if you are coming from out of the state, we can definitely discuss what that packet looks like. Speaking of relocation, we also offer housing assistance at a discounted rate. So we here at Stanford work with different housing around the area to offer discounts for our staff. And then we also work with a company called Landed to offer local housing around the area. My apologies. And we offer down payment assistance, sorry, brain fart, for our staff as well. So definitely a great perk if you're relocating and looking to purchase a home. Maybe you're a first-time home buyer, or maybe you are, looking around the area and are seeing the house prices and think that, you might not be able to do it. Definitely just reach out, because we do offer a lot of really great benefits. Carly?
Thanks, Jen. For those that have been asking in the chat, we will make sure to link Jennifer's LinkedIn. Feel free to add her, reach out to her, also include her email address. She's always happy to talk to candidates that are interested. Kind of pivoting, we're talking about career opportunities. Mary Beth, we get asked a lot, okay, it's 12-hour shifts. I see 12-hour day, 12-hour night. What do those shifts entail? And then a lot of questions about whenever I see rotating positions come up, what does that mean? Is it the shift that rotates, each month? Is it the hours that rotate? There's always a lot of questions for clarification on those particular shifts. So if you can shed some light on that, just for those that are looking, kind of know what to expect.
So just currently on H1, we have day shift positions open. So day shift, like Carly said, are 12-hour shifts. They start at 6:45 a.m. in the morning and go till 7:15 p.m. at night. It's an every other weekend commitment. So for those applying for the days, it's Saturday, Sunday commitment. There sometimes are opportunities within the unit to either go to a night shift or a rotating position. Night shift is 6:45 p.m. to 7:15 a.m. It's still an every other weekend commitment. Night shift weekends are Friday night and Saturday night. So it's a little different in terms of that, what's considered a weekend on night shift. And then rotating positions are those on H1, we rotate every 2 months. So you'd be on 2 months of days and then 2 months of nights. We don't rotate like within the week. We know that you need to be on a regular sleep pattern. So that's why we try to keep it to like a 2-month stretch when we do have rotators. So I think that's pretty much it for the shifts. Teresa, did I miss anything?
No, I don't think so.
Great.
In terms of positions, Mary Beth, do you tend to only have full-time opportunities? We get asked a lot, is there part-time available? Is there per diem relief available? Generally speaking, for H1, is it mostly full-time positions?
Yes. Right now, most of our positions are 0.9. There is opportunity for 0.75. So that's 2 days, 1 week, 3 days, another week. However, that usually those open up pretty about every year or two, and then it goes by seniority on how we offer those. So the most senior person who applies would get that 0.75 position. And right now we do have relief. We don't plan on opening relief soon, just because we have several relief that are I think pretty happy and going to stay for a while.
That makes sense. Teresa, I'm going to kind of give you some time again. Just basics of H1. How many beds do you guys have, and what can potential candidates expect as far as the nurse to patient ratio for H1?
Yeah, of course. So H1 is actually located in the original Stanford Hospital building. So Stanford Hospital has 2 buildings, 300P and 500P, 2 buildings, 1 hospital. So we're located in the original building in 300, and we are a 24-bed unit. We do have some private and some semi-private rooms, and 1 triple room. So as far as nursing ratios go, when our patients are IICU level of care, intermediate ICU level of care, they're in a 1 to 3 patient ratio. And when they're med surge, they can be one to five technically. We generally are 1 to 4, 1 to 5 very rarely. And if they have telemetry orders, then they're 1 to 4. But we generally are able to stay within the 1 to 4 ratio. We also have a charge nurse and a float nurse, as I mentioned earlier, that do not have any patient assignments. So their roles are primarily just to maintain the ins and outs of the unit, do breaks, and manage the day to day. So some great opportunities there. And then as far as nursing assistants, because everyone likes to know about that too, depending on our census, during day shift, we have 2 to 3 nursing assistants. On evening shift, we have 1 to 2 nursing assistants. And then after 11 p.m., if our census is high, we have 1 nursing assistant.
Awesome. Thank you, Teresa. A question came in that I guess could kind of be more broad, but obviously we're talking about nursing, but Mary Beth, in terms of other staff within your unit, what other positions are there available? I know nursing assistants a lot of times turn into our new grads or turn into those that, go off to nursing school, come back. But what other opportunities are there for someone that's like, this sounds like a really fun unit, but I'm not an RN yet, or I have a different career path, but I really want to be a part of this unit?
Great question. Right now, we actually have nursing positions open, but in the future, there could be a potential opening for what we call a unit clerk. They're very key in the operationalizing the unit. They answer the phones. They help visitors check in. They answer questions for people coming to the unit and really manage a lot of items that help this unit run flawlessly. That would be the only non-nursing position that we have on our unit, and then we have our nursing assistants. But as of right now, those positions are all full, but not to say that there wouldn't be opportunity in the future.
Awesome. Thank you. Thinking back to previous events that we've done and just questions that we tend to get, when nurses are applying for different roles, the biggest thing is they're like, I feel like I'm applying and my application goes into a black hole and I don't know maybe where I came up short in my experience or my education. I'm not quite sure, obviously they don't know if someone else was picked for the position, if the position was canceled. They don't have a lot of that information. But for someone that, maybe has applied before, hasn't quite gotten in, is there any advice, Teresa or Mary Beth, that you guys could offer about, go this route and then come reapply with us? Or, if you feel like you want to have a one-on-one conversation, here's a great way to connect with someone at Stanford. What are some tips that you can give people that have been trying to apply to Stanford, or that is their goal, is to eventually get to Stanford once they have so much certain experience? Is it make sure you just have that 1 year of nursing experience to come into the unit? Or, just, I guess they're looking for, real world advice from someone that is managing a nursing unit?
That's a great question. I would really say it takes a good solid 2 years in a hospital setting to get those basic nursing skills down, like time management, some critical thinking. So I would really suggest if someone is out in a hospital setting, and I'm just picking a population, but let's say they're on a neuro 4, to really just hunker down for that 2 years, really get those basics nursing skills down on that unit, and then reapply. And then also, while you're working on that unit where you are at for 2 years, seek out every opportunity to learn and understand. Really be excited to learn, take on leadership opportunities, whether it be precepting a student, if it's being on a committee. Those are all things that we really look for when we do get candidates, or people that are really willing to help the unit be better wherever they're at. We have hired 1 or 2 people that have had LTAC experience, and we saw how much that they they took pride in where they were at currently and the extra mile they went at the LTAC, that we did hire them, and I would say that they have been very successful here. So wherever you're at in your current role, work hard at it, and take every opportunity to learn, because that will really shine through when you come and interview with us, because the nature of our patient population is we're always learning, and we're looking for candidates that have that same excitement about learning. Teresa, anything you want to add?
Yeah, I would just say find a way to highlight those things on your application. If you had the opportunity to precept, be a break relief nurse, a charge nurse, if you're able to get a certification in your nursing specialty, and then kind of find a way on your resume to briefly describe the different patient populations that you've cared for, perhaps the different surgeries that you've seen, is a really good way to sort of let the hiring managers know quickly what kind of background that you have, and what kind of experience that you had. So I think that would be my advice when you're building your resume. But yeah, generally we're looking for people that have, around 2 years of experience. In a smaller hospital, an acute care hospital.
Well, and Teresa, to kind of keep it on you, I guess, you've been here for about a little over 7 years. So obviously you stayed, you love your job. What makes you just love coming to work every day? What has made you decide to stay at Stanford and continue to grow your career at Stanford?
Yeah, so 100%, I would say first and foremost, it's the people. That has really made me feel very committed to our unit as a whole. And then it's really the specialty. I don't think that there's ever been a boring day in this specialty. I feel like I learn something new every day, and I find it really enjoyable and really fun. And then Stanford in general, I just consistently see opportunity for growth and for me to professionally develop. And so every time I reach a point where I feel like, okay, comfortable with where I'm at, there's a new challenge, there's something else to learn. And it really helps combat like burnout and just make me feel like I'm really growing every day. So I think that's really something that I have to say about Stanford, and the people and managers that I've worked with. Have really been invested in helping me grow. And I think that's a really great thing. And that's something that's really important to us as a management team, for our teammates too, to make sure that we know what their goals are and that we're helping them achieve that in any way we can.
Well, I love that. And of course, Mary Beth, you knew I was going to ask you as well. You've been here about 7 years as well. What's kept you coming to work every day? What's made you so invested in Stanford, and why you stay and continue to grow your career here?
Yeah, it's I've had an interesting journey at Stanford, a little bit like what Teresa was saying. You think that you're going to just kind of like find this comfortable position, but they always find a way to challenge you and really challenge you in the way that gives you this satisfaction personally. So I actually started at Stanford in the ICU float pool, as a staff nurse. And there was an opportunity, I did stay there for about a year, to go into the PACU, and I became the assistant nurse manager there. And while I was there, I actually had the opportunity to meet, she actually retired, but she was the manager of the ENT plastic surgery floor. And we connected, and she mentored me. And she really just, saw a lot of potential. And I went through, there was an opportunity to apply to the manager position back in 2019. And I did. And here I am 3 years later, still managing the unit. So also going back to what Teresa said, it's the people. There's, you always find somebody within the organization that wants you to grow and wants you to support you in your ultimate career journey. So it's been an exciting adventure for me, my 7 years, because it's really been just kind of like nonstop learning and actually just a lot of fun, I have to say. Teresa and I, we've been through a pandemic together, being new managers, and we've learned a lot. And we are still coming to work smiling and ready for the next the next week and what we can do to make this unit the best.
Well, I couldn't leave out Jennifer. So Jennifer, just real quick before I swing the conversation back to Mary Beth and Teresa, why do you love Stanford? You've been here. Congratulations. You just hit your 1 year here. I'm so glad you decided to join us. And I know Mary Beth, expresses that same sentiment. She loves having you as her recruiter. What has made you, what made you make the leap? Why are you coming to Stanford every day? What could you tell someone out there? Like, I just don't know what, across the board, not just nursing, but just anyone looking to make the leap to Stanford. What made you choose it? And why are you so glad you're here?
Yeah, thanks, Carly. Funny thing, today is my 1 year anniversary. So yay, I made it. When I was contacted by a recruiter from Stanford, I did not think that I would ever make it here. I'd been working for the same healthcare system for about 4 years, and I just never thought, I just saw them as like, one day, long from now, I will be there. And so I'm really glad that I did make the leap, and I did, switch over. It's definitely been such a fun year for me, lots of learning. And I think what makes me stay and just continue to really enjoy my job is working with people like Maribeth and Teresa. I just really enjoy learning from them. Every day there's something new. I work with a lot of the AAU units, and so I'm always, speaking to different candidates and hearing their stories and just hearing how they've saved lives. Somehow I feel connected to the patients. I feel connected to my candidates, with my managers, and I just wouldn't have it any other way. I love what I do. I love talking to nurses. I love, working with my managers and just learning every day. And what better place than to be at Stanford to do that? It's such an honor to be working for this organization. And I would just say, anyone out there that thinks, they'll never reach out to me, they'll never call me, just apply. I have jumped on the phone with many candidates who just say, can you just talk to me for 5 minutes to just kind of give me advice? I've talked to new grads, I've talked to LTAC nurses, I've talked to experienced nurses that are just not getting a call back. I have reached out to them. I do take those 5 minutes to call these candidates and just kind of give them advice. So always, just reach out. I'm happy to answer any questions.
Thanks so much, Jen. So kind of pivoting off of that. So, once you're hired here, you've accepted a position with Mary Beth, and then it's like, okay, what to expect. So Mary Beth, once they're hired and, they start, what's kind of the orientation period like on your unit? What can they expect once they start? How long will they have someone kind of mentoring them before they're out on their own? What can they kind of expect in those first few weeks or even first few months?
Yeah, happy to answer that question. So the first week that you start is hospital orientation, which consists of sign up for parking. There's health streams that you have to complete. There's an Epic class that you go to, which Epic is the computer charting system that we use here. So that's something that happens during that first week. You come and get your badge, just a lot of the administrative tasks. And then on H1, we normally give 4 weeks of orientation due to the specialty of our population. That is what we have found that make candidates successful. And you are with a dedicated preceptor. Now, sometimes there will be a backup preceptor if there's like a pre-scheduled day off that your primary preceptor has, but we generally try to pair you with a dedicated preceptor. We have a fabulous nurse educator. Her name is Rachel, and you get 4-hour classes with Rachel, and she's really takes a deep dive into our surgeries and the nursing care that we specialize in. So generally that class is given within that first 4 weeks of your orientation. And then as you are out on your own and you're getting your feet wet, being independent, there will be a second 4-hour class with Rachel. And that really gives her an opportunity to take even a deeper dive. And then as you've become more accustomed to being independent and working on your own, it gives you an opportunity to connect with Rachel and even ask some, some more in-depth questions. I would say Rachel is one of our strongest assets. She is out of the count at least once a week, so that she's available for staff for questions. She works at the bedside, so she is very in tune to what the bedside nurses are dealing with every day because she is there. She's living that experience. So she's just this valuable resource that our staff just, they really rely on her. They really pick her brain. And I'm really proud that she's here with us. She's a great asset. And if there's anything that you particularly need, or you feel like you just need more clarification, we definitely will make time and work with that person, whether it be, working we have hired some people that are not familiar with our pumps. Some people from East Coast work with a different pump. So we've actually dedicated time one-on-one with either one of our assistant nurse managers or with Rachel to really give you that one-on-one time that you need if there's any sort of particular thing you really want to work on. Teresa, do you want to add anything?
The only thing I would kind of add is that during your orientation process and throughout your first year, we do have set and frequent check-ins with the management team as well. So while you're on orientation, we'll check in with you weekly and your preceptor to see how things are going, what areas that are still working on and what's going well. And then once you're on your own, we check in the beginning every other week or so, just to make sure things are still going smoothly. And then we do like an informal 6-month check-in and then annual evaluation. So that's kind of just sees how, as a management team, we support you in that first 6 months, especially. But generally, we have a very open door policy, and we're checking in all the time, and people are coming in and telling us how things are going. And then in general, our staff are so great about looking out for each other, looking out for new people. And I always tease the new people, when you're on your own at first, probably every single person that walks by you will ask you, do you need anything? Are you doing okay? So you'll get sick and tired of people asking you 25,000 times a day if you're doing okay. But that's just really how supportive the team is in looking out for each other.
That's really awesome to hear, Teresa. And I think just starting a new job in general is stressful, and then throw in nursing and a pandemic and just so many different factors that hearing that there's just so much support. After orientation, obviously they go out on the floor, they're on their own. A lot of nurses like to get involved with their employers. So Teresa and Marybeth, I don't know who might know the better answer to this. Are there different ways, committees or social groups or anything at the hospital, organizations that, employee resource groups that our nurses can jump in and get involved and kind of feel even more a part of the Stanford community?
I can start off. One major aspect that we have is shared leadership. It's a hospital-wide committee. Each unit has 5 members. So H1, we have 5 members, and they attend a hospital-wide meeting. And it really gets them an opportunity to understand what's happening organization-wide. There's different committees that discuss like educational opportunities. We are a magnet hospital, so there's opportunities to learn what being magnet is. Quality, so if there's an initiative that you want to bring forward to make either like a change in Epic or something, that is the venue to do it. And so we have our council on shared on H1, our 5 members, and those 5 members really look to work with the staff on projects. So, for example, we have basically we celebrate somebody every month. It's called our H1 Ray of Sunshine. So it's run by our shared leadership group with the help of some staff members. And every month someone votes for a staff member that has really stepped up, just has worked hard, maybe is just always coming in with a positive attitude, and we make sure that we recognize that person. And that's like driven by our shared leadership group. So that's one main avenue to get involved, is either you can always strive to be a member, but also working with the members on shared leadership. There are the ERG groups organization wide. There's multiple groups that I'm aware of. There's ones for people, working parents. There's those for those that are Latinx working in healthcare. So there's just a huge amount of opportunity organization wide to become members of that. I would say, like I even took part when I was a staff nurse. I became something called a Caritas coach, which is we have at Stanford. Our nurse theorist is Jean Watson, and she really talks about caring science and what that means. So there's even opportunities to become a certified, like even Caritas coach, and then you even become. Then you as a coach can connect with other coaches within the organization and really connect that way. So there's just so many different opportunities and unique opportunities here. Teresa, do you want to add anything?
Yeah, so there's opportunities as well to become a Epic super user. There have been opportunities within our nursing research department to volunteer for different research projects that they're working on. The informatics group has asked for volunteers to optimize different aspects of our nursing practice. There are always different opportunities for different committees and subgroups that are looking at solving some sort of hospital-wide problem and wanting input from the bedside nurse. So our chief nursing officer puts out a newsletter weekly, and it always is full of opportunities in there of how you can get involved, and different parts of the hospital that are looking for different ideas and input. So I think that's really great. There's always something if you're looking for it. As well as we have a very robust continuing education department that offers a multitude of classes that are available to us as nurses here, and very easy to sign up for because it's all through Stanford. Most of them are at no cost because of their through Stanford, as well as we do have very generous education benefits of $1,800 a year of education monies to be spent towards your continuing education, as well as 36 hours of paid time for education as well. So that's a really great benefit that we have.
Well, to kind of pivot on that, Teresa. So, sometimes we get nurses that come in, they're in their, ADN to BSN program, or they want to go for their MSN. How do you guys support nurses that want to go back to school and further their education?
Yeah, so definitely utilizing that education money and education time is a big one. We're very supportive and doing everything that we can when people are in school in helping them make a schedule that can work with that. And we try to be very understanding as much as we can in doing that. There are also different other opportunities. Mary Beth, if you want to speak more to sort of the opportunities that you used to help pay and support for your schooling when you got your master's.
Yeah, absolutely. Yeah, so I actually got a Master's of Science in Healthcare Administration from UCSF in 2018, and I used the Transformational Scholarship here available at Stanford Healthcare, and it actually paid $15,000 towards my tuition. And how it works is you basically, it's per calendar year. So if you're starting school, let's say in September, you apply. And it's a pretty basic, easy application process. It just you just have to show that you're enrolled in school. You show when you've completed your classes, and then you will get $5,000 for that first quarter, and then you can do it the next quarter of where you can get $5,000. So it's $5,000 per calendar year. So if your school goes 2 years or more, then you can actually then get the whole $15,000. It was pretty painless, I have to say. It didn't require really a whole lot. It just required you signing up and submitting some pretty basic documents, and and getting a total of $15,000 was a considerable. It helped out considerably for that tuition.
And a new benefit that we have for our Corona nurses too is that now you can use your education funds to help with any student loans that you might have towards a nursing degree. So that's something new that we're really excited about, because that'll be really helpful, I know, for a lot of our nurses.
No, that's awesome. And I've heard of the transformational scholarship, Mary Beth, but I didn't really know anything about it. So that's really cool to hear that that's how that works, and to actually know someone that's used it is really cool. And I know we're getting short on time, but just kind of wanted to continue with this conversation. Again, when you're on the unit and you're working and you're here with us, obviously the last 2 years have been challenging across the board for anyone working within healthcare. And there's been a lot of burnout. There's been mental health, struggles. Mary Beth, can you tell me, kind of as a leader, what resources you have available and that Stanford has available to make sure that nurses are making sure to make their mental health a priority and taking a break and stepping back when they really need it most?
Yeah, absolutely. So there is a robust employee assistance program where you can get free counseling sessions. You can call and arrange those yourself. But there's also a program here called Healthy Steps, which I've actually taken advantage of. You can get discounts to apps like Headspace. There's discounts for certain like memberships if you want to join like a yoga class or something. It's changed a little bit since the pandemic, just because there's not, gyms were closed for such a long time. There's even like sessions like you can sign up for that are like 10 weeks long, once a week, that either the help with resiliency, or it's just something you want to work on personally. There's lots of classes that can help you with personal goals, such as even like there's nutrition classes. It's amazing how many opportunities there are on Healthy Steps, and that they're very low cost, or most of them are free. So the organization does have a lot out there to support the staff members that are here. On the unit, I would say that we, again, going back to what Teresa is saying, we have a very generous open door policy. We really take that time to connect with staff. So we have been able to really understand like what their needs are and work with them on an individual basis. We know with the pandemic that there was a huge strain when kids were starting to go back to school, a huge strain when people were working from home, and lives were just completely altered. And it continues, right? The pandemic is still influencing our lives. And I think that as a leadership team, we know that, and we know that we have to be fluid and flexible in how we deal with every individual. And I think that's where we really do pride ourselves, is that we take that time to really meet the staff's member individual and understand, what's going on and how we can help them. Teresa, do you want to add anything?
I think I would just take this opportunity as well to mention Stanford and our Unit H1's really our work against improving workplace violence, and especially when it comes to our patients. And we really recognize that this job can be very difficult. And when you're dealing with people as closely as we are, one of the things that can really lead to that burnout is sort of those difficult patients or family members. So there is a program in place to deal with these sorts of situations that involves the social worker, the nursing supervisors, the management team, and security to set behavior standards and really make it clear to our patients and their families what our expectations is for their behavior with our nurses. And this is something that as a management team has been a huge priority for us. And we are involved closely in these situations and ensuring that our patients are treating and their family members are treating our staff with respect. And I think that is something that I'm really proud of the work that the organization has done and the importance that they have put on that and improving that, because we know it can be very prevalent in the healthcare industry.
Very true. Well, I'm looking at the clock and I know that our time is up here. But just before we signed off, Mary Beth, Teresa, I just wanted to give you a quick opportunity for those, obviously you're looking to fill a couple nursing positions. For those that are kind of on the fence about whether or not to apply, whether it's, because of the specialty or because they're relocating from somewhere else in the US, anything you want to say to those candidates that are out there? Like, I don't know, like maybe just need that little push, like why Stanford or why the ENT plastics pain department versus another AAU here at Stanford?
Absolutely, I can take that. So if you are having any reservations, there's no harm in applying. Teresa and I are very friendly people. We like to talk to people. We like to get to know people and interview. It's an opportunity for you to also interview us to see if we're, what you're looking for, because we want to look for someone that we think will be good for us. But you also have to have the opportunity to just come and talk to us and see if this is where you want to be. Again, I think, our population that we serve, I just think about the patients that have been through so much. Like I think about our breast cancer patients that we get the opportunity to serve. They've been through such a long journey, and now they're coming to us to get reconstructive surgery so they can really just feel whole again and really walk away from such an ordeal. And I think that is just something that we're very proud of. We're very proud that we serve a population that has difficult cancers to treat, and that we are one of the few hospitals in the nation that can serve that population that have to come from oftentimes far away to get help. And, we are here, and we really care about our patients. And I think really for how long some of our nurses have been here and they're so dedicated to this population, I think that's just a great reason to at least apply and come and talk to us. Teresa, anything else?
No, I think that's a really great summary for sure. And I think don't be afraid of the specialty at all. This is a teaching hospital. We do a lot of teaching. We have a really great onboarding process in place that I think will really help you to feel comfortable, and you don't need to worry that if you don't have the experience. We're used to that. We expect that, and we're really excited to teach you.
Thank you, Mary Beth and Teresa, for joining us today. Everyone that's been watching with us for this last hour or even tonight or tomorrow, thank you so much for joining us. It's been great getting to know a little bit more about our H1 unit, which oversees ENT plastics, breast oncology, and pain. Enjoy the rest of your Tuesday, guys, and we will see you here on the next Stanford Live. Have a great rest of your day.